Right. So get us, we're going deep today on something pretty major in critical care.
Oh, yeah.
Yeah. It's all about figuring out when is the best time to start renal replacement therapy.
RRT.
Exactly. RRT for patients who are dealing with septic shock. And, you've sent us a ton of research on this. And one that really sticks out is that IDEAL-ICU trial.
Oh, from back in 2018.
Yeah, that one.
That one really shook things up.
It really did. And that's kind of what we want to focus on today.
Yeah.
So by the end of this, you should be able to confidently walk into any medical discussion about septic shock and be like, okay, IDEAL-ICU, what did it find?
Yeah.
And more importantly, what does it mean for how we treat patients, right there in the moment?
Yeah, we're not just going to give you the textbook answer here because it's way more interesting than that,
For sure.
What's so fascinating about this whole thing is IDEAL-ICU forces us to think about personalized care,
Yes.
not just these blanket rules.
Yeah. Okay, so let's back up for a second. So you've got a patient and they're hit with septic shock. Their blood pressure just tanks, organs are starting to, fail.
Yeah.
And the kidneys often, take a really big hit.
Absolutely.
And so up until this IDEAL-ICU trial, most doctors would kind of rush to start RRT,
Right.
thinking okay, we need to give these kidneys a break. We need to take over the filtering and hopefully stop things from getting even worse.
Yeah, it was kind of the thinking was oh, man, we got to jump in there and save the day.
Yeah, like a backup generator kicking in when the power goes out.
Exactly. A perfect analogy.
Yeah.
But then you've got IDEAL-ICU, this huge international study, hundreds of patients. They compare two groups, one getting RRT right away, the other waits a little bit longer until their condition really demands it.
Yeah.
What happened?
Don't tell me they found that holding off on RRT didn't actually, mean that patients were going to die sooner.
You got it. The 90-day mortality rates were practically identical between those early and delayed RRT groups.
Wow.
Paradigm shift.
Okay, but wait, I can already hear the skeptics out there
Oh.
being like, hold on. Doesn't it seem risky to delay a treatment that we think is so critical? What about all the other complications that can happen with septic shock?
That's a great point. And IDEAL-ICU did find some little differences.
Okay.
So while the big picture, the survival rates were very similar,
Yeah.
the delayed RRT group did tend to stay a little longer in the ICU
Okay.
and needed help with breathing for a bit longer.
So it's not as simple as saying, hey, let's delay RRT for everybody. It's more like IDEAL-ICU kind of added this layer of, well, maybe it's not always the hero we thought it was.
Exactly. And you know what IDEAL-ICU really did was shift the conversation toward personalized medicine.
Okay.
It's about understanding each patient, their situation, how sick are they, what's their medical history, other organs involved, and then making a judgment call about the timing of RRT that best fits them.
So it's not just black and white anymore. It's really about looking at all these different factors and weighing the potential benefits and risks.
Exactly. And that's where a deep understanding of those IDEAL-ICU nuances comes in.
Okay, I'm all ears. Let's unpack this. What are some of the things that clinicians and even our listeners should be aware of when they're thinking about, when to start RRT for a patient with septic shock?
Yeah. Well, one of the big takeaways is if you've got a younger patient relatively healthy and their septic shock isn't super severe delaying, RRT might actually help them recover faster.
Oh, wow. So it's almost like you're giving the body a chance to kind of fight back on its own without immediately jumping in to replace the kidney function?
Exactly. Sometimes too much intervention can actually hinder the body's natural healing process.
That makes sense.
But of course, this isn't a universal rule. IDEAL-ICU also showed us that certain patients might still benefit from early RRT.
Okay, so let's talk about those exceptions. What are some red flags that would make a doctor think twice about delaying our RRT, even with these IDEAL-ICU findings?
Well, one obvious red flag is if the patient already has some kidney issues.
All right.
So if they have chronic kidney disease, their kidneys are already kind of, working overtime.
Yeah.
And then you hit them with septic shock on top of that.
That's a bad combination.
Exactly.
Yeah.
It can be a disaster.
Yeah.
So in those cases, it's better to be safe and provide that extra support early on.
So it's almost like you're reinforcing a weak wall before a storm hits.
Exactly. A great analogy.
Yeah.
And it's not just pre-existing kidney problems. The severity of the septic shock matters too.
Right.
If someone's extremely ill, multiple organs failing early RRT might be their best shot at survival.
Yeah, it's like recognizing when the body just needs that extra help to weather the storm.
Right.
Earlier you mentioned personalized medicine, and that makes me think about biomarkers,
Yeah.
all those advancements that help us predict disease progression.
Absolutely.
Are there any biomarkers that could clue us in on when to make a smarter decision about RRT timing?
There are, and it's really one of the most exciting frontiers in this field. There are certain biomarkers that show up in the blood even before traditional kidney function tests,
Yeah.
start showing problems.
It's like an early warning system.
Exactly. Got it. If we can catch those early signs of kidney trouble, we might be able to intervene sooner,
Okay.
either with RRT or other supportive therapies.
Wow. So we could potentially prevent long-term damage.
That's the hope.
That's amazing.
Yeah.
It sounds like we're getting closer to being able to really tailor these RRT decisions to each patient's individual biology.
Precisely. And that's the beauty of research like IDEAL-ICU. It pushes us to question assumptions and find better ways to do things and ultimately provide more individualized care.
I think our listeners are starting to see the bigger picture here. Ideal ICU wasn't about saying early RT is wrong.
No.
It was about opening up new possibilities for how we handle kidney failure and septic shock.
Exactly. And that's a perfect segue into another important part of this discussion, patient perspectives and shared decision-making. We've talked a lot about the science, but it's the patient who lives with the consequences of these decisions.
For sure. What role should a patient's values and preferences play in this whole RRT timing thing?
A huge role. Some patients might be okay with a wait-and-see approach, even if recovery takes a bit longer.
Right.
Others might want to get back to their normal lives ASAP, even if it means more aggressive treatment.
So it's not just about what the data says.
No.
It's about what matters most to the patient.
Exactly. And that's why communication between the patient, their family, and the doctors is so important. Doctors need to clearly explain the benefits and risks of both early and delayed RRT in a way that everyone understands.
Right. It's about giving patients the power to be a part of their own care,
Exactly. And that includes respecting their right to refuse RRT.
even if the medical team recommends it.
Even then.
Wow, hadn't thought about that. Are there actually times when a patient might choose to not do RRT, even if it could save their life?
Absolutely. For some patients, the thought of being hooked up to a machine, frequent blood draws, and a drastically different lifestyle, that's just not acceptable.
So in those cases, it's about honoring their wishes
Yeah,
and helping them, have a comfortable and dignified end-of-life experience.
exactly. And this brings up another thing we need to think about, the cost of healthcare.
Right.
RRT is expensive, and we don't have unlimited resources.
Yeah.
Delaying RRT when it's appropriate can actually help reduce healthcare costs.
Without, negatively impacting the patient.
Exactly.
So how do we balance the needs of each patient with the bigger picture of healthcare costs?
It is, but it comes down to using healthcare dollars wisely. Doctors have a duty to do that without denying patients the care they need.
So finding that balance.
Right. Finding that sweet spot where we're giving the best possible care, but also being smart about the financial side of things.
And that's where research like Ideal ICU comes in.
Exactly. It helps us identify which patients are most likely to benefit from early RRT so we can use our resources effectively.
This has been a lot to take in.
It has.
We've gone from the initial shock of the Ideal ICU findings to, understanding the subtleties of personalized care, patient preferences, and even, the financial side of healthcare.
It's complex.
It is. It's a lot. It feels like we've only just scratched the surface of this whole RRT timing question.
Yeah.
What started as like a simple question about, when to start treatment,
Right.
turned into this huge discussion about personalized medicine ethics, even the cost of healthcare.
It is amazing how one study can have such a big impact.
No.
Ideal ICU changed how we practice medicine, but also how we think about making decisions in healthcare.
Totally. So before we wrap up, I'd love to get your thoughts on the future of RRT.
Okay.
With all the advancements in technology, are there any big breakthroughs coming that could change how we manage kidney failure in patients with septic shock?
There are some really exciting things in the works. One area that's getting a lot of attention is the development of these miniaturized portable RRT devices. Imagine a world where patients could get RRT at home.
At home.
Or even in an ambulance. You wouldn't have to be stuck in a hospital bed.
That would be a total game changer. What other innovations are you looking forward to?
Another promising area is bioartificial kidneys.
What?
These are basically engineered organs that combine living kidney cells with synthetic materials. They're designed to work more like a real healthy kidney than current RRT technology.
That sounds like something out of science fiction.
It does, but
It,
it's becoming a reality.
so it seems like there's a lot to be hopeful about when it comes to RRT.
Absolutely.
We're moving towards more personalized, patient-centered, and potentially even portable treatments.
Exactly. And I think that's the takeaway for our listener today.
Okay.
The IDEAL-ICU trial challenged what we thought we knew about RRT timing, but it also opened up a whole new way of thinking about how we treat kidney failure in septic shock.
It's not just about following the rules anymore.
Right.
It's about understanding the nuances, looking at each patient individually, and making informed decisions together.
Well said. And that's what makes this field so fascinating. It's always changing, pushing us to think critically and get better outcomes for our patients.
This has been an incredible deep dive.
It really has.
We've covered so much ground, from the groundbreaking findings of IDEAL-ICU to the ethical questions and the future of RRT technology.
It's been great exploring these issues with you.
Hopefully our listeners leaving with a better understanding of this topic and a new appreciation for the power of personalized medicine.
I hope so.
And to our listener, thanks for joining us on this deep dive into the world of RRT and septic shock.
Thanks for listening.
We hope you found it helpful and keep exploring this fascinating and ever-changing field. Until next time, stay curious.